Let me ask you something. Last night, when you finally sat down after a long day, did your legs feel like they were carrying someone else's weight? That slow, deep throb behind your knee, that tight, heavy feeling in your calves that no amount of sitting seems to fix, and those blue, twisted lines on the back of your legs that have been quietly spreading, one season at a time, for years now. You have probably tried a few things. Compression socks, maybe. Keeping your feet up on the couch. Perhaps you looked into a procedure and saw the price tag and quietly closed the browser. I want you to stay with me for the next 12 minutes. Because today I am not going to give you a list of things to Google. I am going to walk you through exactly what to do. Tonight, step by step. No equipment you don't already have. No gym. No appointment. Just you, your bedroom floor, and a routine that takes 5 minutes before you sleep. Let's get into it. But before we go any further, I want to say something directly. This channel is brand new. I started it because I kept seeing people in their 60s and 70s dealing with real, painful problems and getting either a rushed doctor's appointment or a YouTube video full of things they already knew. I want to do something different here. Real information, real routines, step by step, no fluff. But I need your help to reach more people. If this video helps you, or even if you just think it might help someone you know, please hit the like button right now. It costs you nothing. But for a new channel like this, every single like tells YouTube this is worth showing to more people. And subscribe if you want to be here when the next video comes out. I have a lot more coming. Knee pain, back stiffness, blood pressure, sleep problems, all the things that nobody explains properly after 60. One more thing. At the end of this video, I want you to leave a comment and tell me, what health problem is bothering you most right now? What do you wish someone would actually explain to you properly? Because your comment will decide what I make next. This channel exists for you, so tell me what you need. Now, let's talk about your legs. Before we start, let me be clear about who this is for. If you are over 55 and your legs feel noticeably heavier by evening than they did in the morning, this is for you. If you press your finger gently against one of those veins and feel a faint warmth, a slight tenderness, this is for you. If you have been on your feet most of the day or sitting for long hours with your legs hanging down and by dinner time your socks are leaving marks on your ankles, this is for you. Now, one important thing first. If your leg has swollen suddenly, one side only, within the last day or two, please stop this video and call your doctor today. That is a different situation entirely, and it needs medical attention right away. If you have an open sore near your ankle that is not healing, same thing. See a specialist. For everyone else, let's begin. Here is what nobody sits down and explains to you properly. Most people think varicose veins are a skin problem or a cosmetic problem, something on the surface that you either cover up or get removed. That is not what is happening. Inside every vein in your leg, there are tiny valves, small flaps of tissue, no bigger than your thumbnail, spaced out along the inside of the vein wall. Their only job is to open when blood moves upward toward your heart and then snap shut so the blood cannot slide back down. Think of them like a staircase with trap doors. Blood goes up one step, the trap door closes. Up the next step, closes again. One direction only, up. Now here is what happens over time, especially after 60. Those valve flaps are made of collagen, and after 60, your body produces collagen more slowly than it did at 40. The flaps get thinner. They stop closing all the way. Blood starts to slide back down between heartbeats. It pools in your lower leg. Pressure builds, and the vein wall, which is living tissue, not a rigid pipe, expands outward under that pressure. That is what you are seeing on the back of your leg. Not a wall that failed first, a valve that stopped closing fully, and a wall that gave way under the pressure. This matters because it changes what you actually need to do about it. Procedures that close or remove the vein address the wall. They do not address the valve. That is why, for many people, varicose veins come back after treatment, sometimes in the same spot, sometimes nearby. What you can do, what we are doing tonight, addresses the actual load on those valves. We are going to reduce the pressure they have been carrying all day. We are going to drain the reservoir that has been building up since morning. And we are going to do it in a way your body can repeat every single night. Before the routine, I want to point out 3 things that most people over 60 do every evening that make this worse. First, sitting with your legs bent tightly at the knee for long periods. That crease behind your knee is where a large vein runs close to the surface. When you sit with your knees bent at 90 degrees for 2, 3, 4 hours, watching television, reading, you are partially compressing that vein. Blood pools below it. Pressure rises. The valves downstream take extra load. Straighten your legs when you sit. Or better yet, elevate them. We will get to that in the routine. Second, finishing your evening with a long hot shower or bath. I know, that hot water feels incredible after a hard day. But heat causes your veins to dilate, to expand. And a dilated vein cannot hold valve closure properly. The flaps cannot meet. Blood slides back. You do not have to give up your hot shower. Just end it with 30 seconds of cool water on your legs. Not cold, not ice. Just noticeably cooler than warm. That is all it takes to bring the vein walls back to their resting tone. Third, eating a high-sodium dinner and then lying flat. Hidden sodium in cured meats, hard cheeses, packet sauces. It causes your body to retain fluid in the tissue around your veins. That extra fluid puts outward pressure on vein walls all night while you are horizontal. The swelling you wake up with, that tight feeling in your calves in the morning, that is partly last night's dinner. You do not have to overhaul your diet tonight. Just be aware. And we will come back to what to add, not just what to remove. All right, let's walk through the routine. 5 steps. You can start tonight. This one is for the morning, not bedtime, but it sets up everything that follows. Before your first cup of tea or coffee, stand barefoot on a hard floor, feet shoulder width apart. Rise up onto your toes, fully, heels completely off the ground, and then bring your heels back down with a firm, controlled contact. Not a drop, not a stomp. Controlled. Do this 30 times, 1 per second. 30 seconds total. The muscle you are activating, the soleus, deep in your calf, is the most powerful venous pump in your entire body. When it contracts, it physically squeezes blood upward through the deep veins of your lower leg. After a night of lying still, that pump is cold. These heel drops wake it up before gravity gets its first move of the day. If you do nothing else from this video, do this every morning. This is not exercise. This is keeping the pump running. Every 30 minutes of sitting, do this. 10 slow ankle circles in each direction, then 10 calf raises from your seat. Heels up, hold for a second, back down. 45 seconds. Set a timer on your phone if you need to. When you sit still for long periods, the blood column in your lower leg just sits there. It presses down on those valves continuously. Every time you move your ankle, you activate the calf pump and push that column upward. It is the difference between a pump that runs regularly and one that sits idle for 4 hours. This is the most important part of the routine. Do this 1 hour before bed, not right before you sleep. Lie on your back. Put your legs up, against the wall, over the back of the sofa, or on 2 firm pillows stacked under your calves and heels. The one requirement is this: your heels must be higher than your heart. A gentle angle is enough. You do not need to go vertical. Stay there for 15 to 20 minutes. Here is what is happening while you lie there. The fluid that has been pooling in your calves and ankles all day, the fluid that was pressing outward on your vein walls and inward on your valve flaps, is now draining back toward your body center by gravity alone. Your valves do not have to work for this. Gravity is doing the job for them. You are emptying the reservoir deliberately while you are awake and in control, so it does not redistribute at 2 in the morning while you are trying to sleep. You will know it is working when you get up and use the bathroom afterward. You will urinate more than you expect. That is correct. That is the fluid from your legs now cycling through your kidneys. You drained it on your schedule. After your elevation, when you shower before bed, finish with 30 seconds of cool water on both legs from the knee down. Not cold, not ice. Cool. What you will feel is the skin tightening. What is actually happening is the vein walls contracting, returning to a narrower diameter, and the valve flaps moving closer together. You are passively closing the valves that gravity opened during the day. This is a method that has been used in European physical therapy for over a century. It is simple, costs nothing, and takes 30 seconds. When you get into bed tonight, place one firm pillow under your calves, just enough to keep your heels slightly elevated above the level of your mattress. You do not need a wedge pillow. You do not need a special product. A regular pillow folded once works perfectly. This keeps the venous drainage angle working gently through the night instead of letting everything pool back the moment you lie flat. The routine works faster when you give the collagen in your vein walls the raw material it needs to rebuild. 3 foods. No supplements required. Buckwheat. Not buckwheat bread, whole cooked buckwheat. A 100-gram serving contains more rutin than almost any other food you can buy at a regular grocery store. Rutin is a compound that strengthens the collagen matrix of the vein wall and reduces capillary fragility. Multiple clinical trials have shown it reduces leg heaviness and swelling in chronic venous conditions. 2 to 3 servings a week. It costs less than rice. The white pith of citrus fruit. When you peel an orange and eat only the juicy segments, you are leaving behind the layer where hesperidin and diosmin are concentrated. Diosmin is the active compound in prescription venous medications used across Europe. You do not need the prescription version. You need to stop throwing away the pith. Eat the whole segment. It takes no extra effort. Tart cherry, frozen sour cherries or tart cherry concentrate, 2 tablespoons in water in the evening. The dark pigments in sour cherries have been shown in phlebology research to reduce inflammation in vein walls and support the collagen integrity of valve tissue. It also helps with sleep. Add it to the evening routine. I want to be honest with you about what to expect and when. In the first 3 to 4 days, the evening heaviness will begin to lift. Not because the veins have changed, but because you are draining the fluid reservoir before it builds overnight. By the end of the first week, the sock marks on your ankles should be less pronounced. Swelling reduces before appearance does. At 2 to 3 weeks, some of the smaller surface veins may begin to fade slightly. Spider veins respond faster than larger ones. The larger varicose veins, the ones that have been there for years, those take months. Collagen synthesis is not fast. The valves rebuild slowly. Give this 3 months of consistent daily practice before you evaluate whether the larger veins have responded. Take a photograph of the back of your legs today. Compare in 8 weeks. Your eyes adjust to gradual change. The photograph will not lie. Here is what I want you to do in the next 2 hours. When you take your shoes off tonight, before anything else, do 30 heel drops on a hard floor. That is your starting signal. You are telling your body, we are managing this now. Then, 1 hour before you sleep, get on the floor or the couch and put your legs up for 15 minutes. Heels above heart. Let gravity do the work. Finish with cool water on your legs in the shower. Get into bed with a pillow under your calves. Tomorrow morning, 30 heel drops before your first drink. Every 30 minutes during the day. Ankle circles, calf raises. That is the full routine. 5 minutes of active effort. The rest happens while you are already resting. The veins on the backs of your legs are not a cosmetic problem waiting for a surgeon. They are a signal from valves that have been fighting gravity alone for years, without the support they needed. You can give them that support, starting tonight. And before you go, I want to ask you something. Drop a comment below and tell me what health problem is affecting your life the most right now. Knee pain? Back stiffness? High blood pressure? Poor sleep? Diabetes management, joint aches, whatever it is, write it below. Because your comment shapes what this channel covers next. I read every single one, and I will make a video on whatever comes up most. This channel is new, and it exists for one reason only, to give people over 60 the clear, honest health information they deserve. If this video helped you, please like it. Share it with someone whose legs ache by evening. And subscribe so you do not miss what is coming next. I will see you in the next one. Take care of those legs. They have carried you a long way.